This is the Working with Warriors podcast by the team at the Regional Men's Health Initiative.
Hello and welcome. My name's Owen Caddo and I'm joined today by fellow team member Terry Melrose and our special guest once again, Ross Ditchburn. How are you guys?
Very well, thank you, Owen, and it's good to be here.
Yeah, good, thanks, Owen, and good to have you back in the studio, Ross.
Yeah, thanks, mate. It was a bit of a long trip up from Bunbury this morning, but the rain will be welcome in the out in the countryside, I'm sure.
Yeah, it will be. Now listen, Ross, we talked to you back in 2020 in podcast episode 5 when we were exploring our talk to a mate theory and just about the importance of mentors, peers and partners in your life's journey. And then we did say then that we're going to come back and specifically talk about your prostate cancer journey. And in that podcast, we did say, amongst other things, that you're obviously a cancer survivor, but in front of that, you're a farmer, a dad, AFL, VFL football with a premiership medallion for the mighty Blues. So we're allowed to say that again because we're Blues supporters. And played a lot of country footy and sport. So a pretty robust past there, Ross.
Yeah, it has been, Owen. I've certainly got no regrets on what's happened in my life. And it's been really good. The experiences I've had since I've finished playing sport has been very fulfilling. A little time on the Dumbley Shire, giving a bit back to the community. And then when I discovered Regional Men's Health, and was forced onto the committee by one of your esteemed ex guys that controlled the program. I've really enjoyed my time with Regional Men's Health and been able to give a bit back through my experiences.
No, look, and we've enjoyed the company as well, Ross, and I guess we've been, the last few podcasts we've been talking about men's sexual wellbeing and just establishing what it is for us as blokes and talking about a whole lot of things around prostate cancer, prostate enlargement, testicular cancer and all the other bits that are important for a man. And we thought we'd just get you back in and talk specifically about your prostate cancer journey, Ross, because it's you've been in it a number of years now, and right up front, we've just got to say, once you've had cancer, you are a cancer survivor, and that's a bloody good thing.
Yeah, it is, Owen. And when you look at the stats around prostate problems, prostate disease affects 1 in 2 men in Australia, and prostate cancer affects 1 in 5 men. So the numbers are really quite significant. It's the second most common cause of cancer death in Australian men. But the thing that we've all learnt during the process is that early detection means a very, very high chance of survival. So that's the thing that I've noticed happening throughout the men's community in regional WA. In my time with Regional Men's Health is that they're talking more about it. They know what their PSA levels are and that's going to lead to very high survival rates throughout regional men. When I turned 50, I received a letter from the state government saying that I could go and have a free checkup with my local GP. I did that. I went and had all the tests done, all the blood tests and just an overall checkup. And when the doctor got me back in there, he said, your PSA level's 3.7 or something like that, probably a little bit high, but we'll just monitor it. And I wasn't aware of what the prostate actually did at that stage or what the PSA level indicated. So it wasn't until I was 52 and my wife Jodie was going to have a mammogram or a pap smear or something, and I thought, I better go and have my checkup. So I went back. My PSA level had elevated to 11.5, and immediately the doctor who was there at the current time at Lake Grace said, I better give you a erectile examination, and he felt a lump, and it was from there that we were, into action. Straight down to Perth for a biopsy. The biopsy revealed quite aggressive cancer, and the Gleason score being 8 out of 10, which is really quite significant. meaning it was a very aggressive cancer and probably couldn't wait too long. I was very fortunate that I probably went to see Tom Shannon, who is probably the most experienced and most switched on prostate cancer man at that stage. And he said, "You're probably pretty lucky you came to me because there's a few other doctors that might not tackle this." So I felt pretty fortunate I was in his office and not somebody else's office. But so that was a bit of a eye opener for me, and I know now that they can use imaging and that sort of stuff also to detect cancers.
And you say a bit of an eye-opener, Ross. I just wanted to go back to your just initial thoughts, feelings, and just normalise a bit of obviously what you were going through. Because I know as blokes, we always I've heard blokes say, I don't want to go to the doctors because I don't want to find out there's something maybe wrong with me. We have that anxiety and fear. And the fact that before 50 you never knew about prostate cancer or even what the prostate was, that's a fair bit to get lumped on a bloke. Can you remember what you were feeling, thinking at the time, what emotions you were going through maybe?
It sort of hits you pretty hard when you hear the word cancer, and it takes a couple of days to sink in, and then you really start to focus on what you've got to do to get rid of that cancer. And there was no taking risks as far as I was concerned. We had discussions with an oncologist about nerve-sparing operations and all that sort of stuff, and I really did not want to take a risk to preserve my erectile function at that stage because it was so aggressive. They'd put me in and taken scans of my bladder, my bowel, and the surrounding areas of the prostate, and we were very, very comfortable that the cancer hadn't sort of got outside of the prostate. So it was pretty much get on with it, and like the alternatives, the consequences of having your prostate out, meant that you could lose your erectile function, but that wasn't a problem as far as I was concerned. It was more of a problem for my wife, but she was pretty good at sort of sussing out what things were available when it came to the time.
Come to that, yeah.
I do remember you saying, Ross, Jodie, your wife, was a really important part of that process in terms of doing research and all that sort of stuff on finding out what you could do and what you couldn't do. And that diagnosis is just so important because the PSA and we've explained it in previous podcasts, but that prostate-specific antigen blood test has still got a really significant role. Doctors now discuss the risk factors, but the PSA benchmarking and ongoing, and I know there's still lots of argy-bargy about it, but for you and your doctor picking up that increase in number in a short time is just the value of it, and we need to focus on it, because when you speak to people that are prostate cancer survivors, ultimately it was through the PSA changing.
Yes, that's correct, Owen, and people now are talking about their PSA levels, and the worst thing that could happen is for men to have to go and pay for a PSA test, and it's something we're facing at the moment. And I know if you've got history and you're in the zone and that, you can actually get a free blood test, but it'd be really nice if all blokes could go and have all their bloods checked and not have to pay a cent for any of those, because what it saves the government and the medical fraternity cost-wise down the track is huge, because early detection means get in control of it and don't block up the hospital system. So, yeah, it's a real shame that happened, but we'll work pretty hard to try and turn that around if we can.
Yeah, no, absolutely, and we have talked about that, and it's a challenge going forward. So you've had that's happened in a short time, Ross, and then that decision to have the surgery, the treatment option, did that take you time to make that decision, or it was pretty clear cut for you?
That was clear cut, Owen, and I had no time, so it was between biopsy and having it out was less than a month.
Oh, wow!
So that was the concern that Tom Shannon had with the aggressiveness of the cancer that was there. So It was basically get everything else checked, and then once we knew it wasn't outside of the prostate, straight in and out it came. So, and I think that happened on the day before Jodie's birthday, and she'd planned something the next day on her birthday, but she came in to see me the following morning, and Tom Shannon said, "Well, you got to take him home." So she thought she'd have a day, at least a day to spare, but that's how quickly it all happened, and of course once you're in hospital, they like to get you out as quick as possible, and I had to deal with a little bit for a week or so, with the catheter in, and it was a bit awkward, but I'm still here to tell the story, eh?
Yeah, look, that's really important, Ross, and it's good to see that pathway of when it's important that you're diagnosed surgery in a month, and we're still hearing that access is available now for people, when it's a high rating.
Yeah, and
high grading
there's
cancer.
Obviously a lot of other options available to people with prostate cancer these days too, Owen, and it's not everyone has to have their prostate out, but you just got to keep an eye on it, detect it early, and then discuss with your oncologist what the best options are.
And obviously at the time you were still on the farm, Ross. How did you manage that? There would have been a fair bit of travel and time away, just for our listeners out there.
Challenges after there was a few challenges, but after I had the operation, I had to stay in Perth for a week, and another farmer from Cookham, Jim Davidson, his wife Wendy, had a house not far from Murdoch Hospital, so they allowed us to stay in their house, which we're very grateful for. And it was just we just had to stay there, keep an eye on things, and once the catheter came out, I could go home.
And post that treatment, Ross, like we talk about a trifecta of outcomes, so one is the cure, and then the urinary incontinence, resolving that, and then erectile dysfunction, and that affects a lot of people at the end of the day. But you, to start with, the incontinence, that was sorted pretty quickly, or just resolved naturally?
I was actually very, very good at doing my pelvic floor exercises, Owen, because that was part of the before I had the operation, they put the camera down the eye, and as they're going through to check the bladder and all that sort of thing, they can actually stop it halfway and show you how your pelvic floor exercises actually go. And they said, "Wow, now you're very good at this." So I practiced and exercised a lot before the operation, and then when I came out after the catheter came out, I think it would have only been probably a day or two wearing a pad, and then I was quite comfortable. I had control of it. So
now you've always been pretty active and on the farm and played a lot of sport. Do you think that worked in your favour a bit, mate? That you're in pretty good nick before you went in for that surgery?
Yeah, things have changed a little bit. But I did spend a bit of time up the farm recently and lost a bit of weight. So that's how it is. Regular exercise and not quite so much in the mouth is very, very important, and certainly it helps. But yeah, fitness levels definitely would help control your incontinence issues.
Yeah, your body fitness level is really important, but the key that you said, Ross, that, the pelvic floor and you doing those exercises and being prepared. When we talk to other specialists, they actually say the number one thing that if they could get blokes, 6 weeks out, a couple of months out from their prostate surgery, and they could do some pelvic floor training, for want of a better word, just age recovery. And that's why that incontinence is probably up around 95% successful now.
Yeah, I think it benefits all men, not just guys with prostate cancer, but I think it benefits all men in their later life and being able to hold onto it and not dribble too much afterwards and all that sort of stuff.
Yeah, that's...
And we did touch on that in our previous podcast when we introduced the prostate and spoke about prostate enlargement and the benefits of doing that through the journey. So really important to check out that one on some of that stuff.
Yep. And then, so the third part of the equation, Ross, erectile dysfunction, because you had a full prostatectomy?
Yes, I did.
Like a
radical.
radical.
Yep.
So that makes it, because of the nature, and it's a bloody hard thing to operate on. So lost full erectile dysfunction.
Yes, I did. Dr. Tom Shannon told me and my wife that it'd probably be 3 months before anything of any description sort of came back. He did say the next morning that he probably took more nerves than he thought he might have had to, but that was part of the no risk policy that we had about getting rid of the cancer. So that started a long journey, Owen and Terry, but it was one that we embraced, and obviously when you're only 52 years old and your partner's a bit younger, then really it's very, very important that you do whatever you can to try and get it back. So we went through the medication, every different coloured pill you could swallow, I swallowed, and a couple gave me a headache, that's about all. None of them worked very, very well. We tried a range of cylinder pumps that were very, very impressive, but most of those you had to flick a rubber ring off the end onto the old fella to try and keep it up, and every time you did that it went down. And in my life, everything I put a ring on fell off, so I thought, well, we'll try and steer away from this and find another option. So we went to self-injection, which it didn't work too bad. But my first experience was with a doctor called Dr. Palmer, who worked from the Keogh Institute. They must have been doing some experimentation with the different types of injection fluid, and the one that he gave me reacted to my system, and from the moment he put it in to the moment it came down, I was in extreme pain. So I think he was due to play golf that day too, Owen, and he got held up at the surgery there for about 2 hours trying to get mine down with Sudafed and hot towels and whatever else he could find. So that sort of scared me off self-injection for a couple of months, and I went back to Tom Shannon, and he put me onto a guy called Stephen Adams, who was a sex therapist, and he said, "Oh, no, there's a various number of things we can use in the injection." So he tried another one and it worked perfectly. I remember walking up St George's Terrace to Collins Street and him giving me injection, and we'd booked into the Emerald Hotel, I think, that night. We'd come up from Mandurah, we were on holidays, and walked back there and sort of, I had my raincoat on and pretty happy with what was underneath, and got back, and that was our first sexual experience, and that was probably some 6 months after having the operation. So it was the first sexual experience we had without hurting, if you know what I mean. That's what.
And was that was someone injecting you, or that wasn't you needling into your dick?
Yes, that was him showing me how to do that.
When you see people, or with diabetes or using those EpiPens and injecting yourself, and then the kind of the idea of putting it in your dick really concerns me, Ross. So, but you could do that in the end.
I think it was going to turn me into an alcoholic in the end, though, because you needed a couple to get the courage up to actually do it in the first place. And that, as time went on, it was sort of became harder and harder. And
excuse the pun.
Yes, of course. But and that's when we thought, well, there's got to be a better option, and we were Stephen Adams put us onto a doctor called Dr. Jeffrey Thevasilan, who was a small Indian doctor who was actually born and raised in Katanning. He explained to us about the penile implant, and it sounded so good. So we went down that line, and that's what I've still got today. It's probably wearing out a little bit and losing a little bit of its. Is
that through overuse or just wear and tear on the machine?
I think I've had a couple of falls over the years, and maybe it's just sprung a little leak, because now I can't quite pump it to its maximum, and I might have to put a Vulcan patch on it, I think.
Needs a new valve.
Yeah. But anyway, it's still working okay at the moment, so we'll give it a little bit more time before I go back to Jeffrey Theverseelen and see what the process is to either replace it or to repair it or whatever.
But just stepping on from the knee, that was a really practical solution to the erectile dysfunction issue, like the pump.
Yeah, it's probably the most. Yeah, there's a little pump in your ball bag in between your testicles. You've got to be pretty careful.
Which one you squeeze?
Yeah, which one you squeeze. So that's a job that my wife didn't want, but it's one I didn't want to give her. So, but yeah, it's a pretty simple operation where you could actually just pump, about 20 times with your little fingers, and then it had a relief valve in it, and it didn't go down until you hit that relief valve. So that was quite unique and different to what had happened all the rest of my life when it goes down and stays down and that sort of thing. So
now through this whole treatment process, Ross, obviously a lot of options were thrown at you, and you tried obviously a lot of things. And through this whole podcast series, especially around sexual health and wellbeing, one of the key things we've spoken about is the importance of talking to our partner is so essential, no matter what stage or what part of our sexual wellbeing it's around. Just how important was that with you and Joe to talk through these things, and how did you sort of approach that, mate?
Well, Jodie was she was very good at online stuff, and she did all the worrying about me dying and all that sort of stuff, and therefore she got online and researched it big time, and eventually she realised that it was one of the cancers that you had a really good chance of getting over. So. But she was absolutely brilliant in her support for me and encouraging me to try and find that option to keep that intimacy alive in our relationship, and that is so important because so many problems can be solved with a kiss and a cuddle and that closeness in a relationship. So if you lost that, it could gives you that. Takes away that tool that enables you to kiss and make up and get over things and all that sort of thing. So that was one of the most important parts of the recovery and life going forward. So glad that I had Jodie there to support me through that, and she's been open enough to talk about her experience, through the video that we did explaining what happened, and she's been to a couple of functions and talked about the female side of prostate cancer with me as well. So she's a little bit over me talking about it now, but I still think it's pretty important that men still keep talking about this subject and make sure that if anyone's got it, that they detect it and get over it.
Look, and we say as well, Ross, we've been talking about through these podcasts that men's sexual wellbeing is important because we've got a prostate. So having a partner on our journey is really important and valuable and aids our recovery, and having some intimacy is really important. But if I'm a bachelor as well, I've still got a prostate. So men's sexual wellbeing is still current issue with us. So we're just trying to, by talking about it, we can encourage those blokes with a partner and without a partner to get tested, and there is a heap of support options now, perhaps even compared to 10 to 12 years ago. And I see the Prostate Cancer Foundation have just put out a new portal as an app. So the amount of information on there alone is just incredible. So let's have that conversation, and by hearing someone's journey, that's a really powerful thing in what you've been through, Ross.
Yeah, I had a quick look online yesterday, Owen, and there is some fantastic stuff online for people to tap into. If you like Google prostate treatment or something like that, you'll come up with the Prostate Clinic, which has got some unbelievable stuff on their website. Tom Shannon actually taking people through the machines and all that sort of stuff that they use these days. You've got Melissa Hadley Barrett, that's a nurse specialising in sexual function. She's doing some wonderful work with Joe Milios with her pelvic floor physio work, and then you got Genesis Care and holistic therapies as well. So there's a whole range of different treatment options in the fighting cancer, but there's so much online available that you can just Google prostate treatment or prostate cancer and you'll find what you need to know.
And you mentioned that obviously the Prostate Cancer Foundation, Owen, Andrology Australia, which is now Healthy Male, a lot of information. But yeah, through PCFA, there is a specific program called Mates Connect, where there is a free support line blokes can call and also get access to a prostate cancer specialist nurse. And through that, just for our country guys too, there are some regionally based support groups out there. I know you do a lot of talking to a lot of blokes, Ross, through your social networks, but if any blokes are feeling a bit isolated or they just want to talk to another bloke who have been through it, through that Mates Connect, there's a whole list of support groups who either meet face-to-face or online.
Look, and Ross has done that live, face-to-face, for your prostate cancer journey from when you got diagnosed till currently today, and probably remiss of me early on too, Ross, to say Ross is our current chairman of Regional Men's Health Initiative and has been for the past 8 or so years, and so we appreciate your support and your genuine interest in this. And I know you've had a lot of that face-to-face make contact with people ringing you up and badgering you, but you just listening to their stories about their prostate cancer diagnosis.
Yeah, and it's good now that, like, when I turn up at a bowls carnival or something, the bloke will say, I've got somebody you need to talk to, or somebody wants to talk to you, or whatever. I said, yep, just put him on, here's my number, give it to him. And I feel that many calls about guys that have just been diagnosed, and I'm just only too happy to talk and help them. And yeah, but there are also a lot of chat shows online as well that Jody got involved in talking when we were talking about getting a penile implant. She was on there talking to guys about how they'd how it went for them and all that sort of thing. So
yeah, no, look, it's pretty powerful stuff, and I just reckon when people tell their story, and we thank you for telling your story on our podcast, Ross, because it's we know we get good feedback and helps one person to do something about it while we're in front. So
no worries.
Yeah, well, no, thanks guys, and thanks Ross for coming up and doing a podcast, and Terry, and just in summary. Yeah,
look guys, just as always, some key takeaways and just some things to remember. Obviously, really important just to be aware of our body and any changes occurring. Obviously, sexual dysfunction and problems can increase in men aged over 50, so make sure we're taking up those health checks and that routine service visit, and just talking to your partner, talking to your doctor, having that conversation, so important. And just being aware that, sometimes underlying, there can be other physical health issues going on with sexual dysfunction. So, like Ross said, the keeping active, good diet, exercise, doing those pelvic floor exercises is really important through for all of us blokes out there regarding our sexual health and wellbeing.
Yep. No, so thanks very much, Ross and Terry, and we'll catch up with our listeners in podcast land in another podcast. Cheers.
Thanks for your time, Ditchy.
Yeah, it's been a pleasure, and 30 minutes of exercise a day, get that heart rate up, and watch what you eat.
Good heart health for good heart health.
Good on you. Cheers, guys.
Thank you for listening to our Working with Warriors podcast series.
Talk to a mate, just let it